wonder what is leukemia and how does it form, what is treatment, what are the types. Today I'm going to answer all your questions by talking about leukemia. So, what is leukemia? Basically, leukemia begins in a cell in the bone marrow. The cell undergoes and changes and becomes a type of leukemia cell. Once the marrow cell undergoes a leukemic change, the cells may grow and survive better than the normal cells. Over time, the leukemia cells crowd out the development of normal cells. You may find that knowing more about the disease and the treatment may help you cope with it more. So, let's talk about types of leukemia. We have 4 types of leukemia. The first type is chronic lymphocytic leukemia. It's a type of blood cancer that begins in the bone marrow. It's the most common type of leukemia in adults. Second type is hairy cell leukemia. Many people with hairy cell leukemia live good quality lives for years with medical care. Third type of leukemia is B-cell polymorphocytic leukemia. It's a very rare and typically aggressive malignancy cancer characterized by the out-of-control growth of B cells. Fourth type is T-cell polymorphocytic leukemia. It's an extremely rare and typically aggressive malignancy cancer that is characterized by the out-of-control growth of mature T cells. For example, like swelling out the lymph nodes, skin rash, low red blood cells counts, anemia. Symptoms of leukemia: fever, losing weight without trying, easy bleeding or bruising, or bone pain. The causes: scientists doesn't understand the exact cause of leukemia. It seems like it developed from a combination of genetics and environmental factors.
They're expecting him. The pathologist has confirmed he has leukemia.
Sully has pre-B-cell acute lymphoblastic leukemia. It's the most common type of leukemia in children.
We just started maintenance today, which we've been doing frontline treatment for 9 months. We've been inpatient for probably close to 30 plus days. But Sully is considered high risk because of CNS, which is disease in the spinal fluid at time of diagnosis.
Okay, wow. Okay, treatment of leukemia. Doctors may find chronic leukemia in a routine blood test before symptoms begin. If this happens, or if you have signs or symptoms that suggest leukemia, the steps to do this is physical exam, blood tests, bone marrow tests. That's all. Okay, you can go.
There's a lot more emotional stress and pressure that's put on the kid to just, you have to get through it. So, you know, there's so little she gets to control. And when we think about what are the side effects that any kid goes through, people really think about the basics, and it's the baldness and the nausea, but there's hundreds of things. The hard part, and I get a little emotional about it, is there are costs, there are huge costs, but she's here, and that's what we go for. So I think that the side effect that probably scares you the most, or what you think about, is what if it doesn't work, or how much time are we buying? And in her case, we're really lucky because we're still talking cure. We're not having to buy time. That's not what we're doing at this point. But it doesn't feel lucky all the time. Even on her lowest day, what I want is for people to understand this is the true part of it, and this is just the beginning.